My talk is, it's going to be quite different from the two other talks. It's really catching up on a couple of the things that we've talked about primarily over the last couple of years. And I'm conscious that there are some people who are new and some people who've seen the talks in the last couple of years. So hopefully I can try and cater for everybody's needs. My name's Elizabeth Forsythe. For those of you who don't know me, I'm a consultant in clinical genetics and I work in the clinics at Great Ormond Street and also at St Thomas's Hospital. And so I know lots of you, I know lots of the kids, I know lots of the adults, but there are also some people from Birmingham who I haven't met. And welcome to all the new people. So today, I'm going to cover three things. So I'm going to talk about the Setmelanotide clinics, I'm going to talk about our registry, and I'm also going to talk a little bit about sleep today. So three things. And first of all, I'm going to talk about the Setmelanotide clinics. And I just wondered, because I've talked about this several times over the years, who doesn't know about Setmelanotide or the Setmelanotide clinics? Is there anybody here for whom this is completely new? Yes, there are quite a few people for whom this is completely new. Phil, it's not new for you. You can't put your hand up. Okay, all right. So I'll give you a little bit of background, okay? So we'll start off. So Setmelanotide is a relatively new drug. So I'm showing a picture on the screen here. It's from a website for the National Institute of Clinical Excellence. They are the body who decide which drugs we can prescribe in the UK and which ones we can't. And what I'm showing in the picture is that in May 2024, they licensed this drug called Setmelanotide, which is a drug for weight management and also for excessive hunger, which we call hyperphagia, in people with Bardet-Biedl syndrome. It's a very specialist drug, so it's only licensed for a couple of conditions, and Bardet-Biedl syndrome is one of them. And for now, it is only licensed for children, so it's not licensed for adults. That may change, but for now, it's only licensed for children. And obviously for us, that was really exciting to have a new drug, a new way of managing weight and excessive hunger in BBS. And there are a couple of different things. So once we had the approval to go ahead, there are a couple of different things that we needed to consider in terms of who is eligible and also a little bit about the side effects of this drug. So the people who are eligible are people who are not able to maintain a healthy weight. So there is a certain cutoff of your BMI score. It is also people have to have excessive hunger, hyperphagia, and we have a questionnaire that we use to measure whether people have hyperphagia or not. It sounds odd, but sometimes it can actually be quite tricky because people who feel hungry all the time, you only know your own experience in your own body. You don't know what other people experience. So if we just ask someone, do you feel excessively hungry? Well, your only reference point is yourself, right? But we have a questionnaire that measures that. We also need to make sure that the people we prescribe it to, that it's medically safe for them. That goes without saying. And at the moment, as I said, we can only start it in childhood. Okay. And one thing I forgot to add to this slide is also that of course, you have to have a diagnosis of BBS and you have to have it confirmed genetically. And most people who come to the clinics do have it confirmed genetically as well. So a little bit else about some other things about the drug that some of you may know about. It's an injection under the skin, like lots of weight loss drugs are, an injection under the skin. And the kind of side effects are similar in many ways to other weight loss drugs. So because it's an injection under the skin, you can get some sort of problems that are related to the injection. So you might get a bit of redness, you might get a bit of swelling, and you might get a bit of pain. Generally, we get around that by asking people to rotate. So they inject it in their tummy and we ask them to rotate it around the tummy where they inject it. And generally, we can get around that. The other side effects are also things that we often see with weight loss drugs. So having a bit of nausea and sometimes having some tummy trouble. Generally, we expect those things to be there in the beginning, and then they tend to get better over time. And the other thing that's more specific to Setmelanotide in comparison to other weight loss drugs is that it has an effect on skin color. So most people get slightly darker skin when they take the medication, and if they stop, it tends to go away. And it takes about 3 months for the darkness to kind of get to the max amount, and it takes about 3 months for the darkness to go away. And I'm just going to show you some pictures. So this is a person, not with BBS, but with another condition, who's been treated with setmelanotide. And what I'm showing you here is at the top, you can see the child before setmelanotide, and at the bottom, you can see this child after setmelanotide. And what you'll notice is the skin color has gone a little bit darker, and the moles tend to go a little bit darker as well. Okay. So that's a very brief overview of setmelanotide. So what happens if your child wants to take part? So this is a little flow chart of what we expect to happen. So first of all, we've got 2 clinics in the country. So we've got one at Great Ormond Street, and we've got one at Birmingham Children's Hospital. And if your child takes part, they will go to whichever clinic they normally go to. But it's all centrally prescribed by either Birmingham Children's Hospital or Great Ormond Street Hospital. And the first thing we want to do is just check whether you're eligible for setmelanotide and whether you would like to start setmelanotide. And after that, people are invited in. So they come for 2 clinic appointments in the first instance. The first one is to come in, answer any questions. We answer any questions you have, and then we do an assessment to check, is this a good drug for your child? Do we think this is going to be effective? Does it help with some of the difficulties that your child may have? The second bit down here is we then invite you in for clinic appointment 2, and that is where we start setmelanotide. So when someone comes in for clinic appointment 2, we have the drug ready, and one of our nurses will show you how to inject the drug, and you'll have training to make sure that everyone feels happy and safe to do this. Now, after that, people go home. They have a delivery of the drug by what we call a home care team, which is essentially a nursing care team who work in the community, who will deliver the drug to your house before the second appointment. They will also come into your house the next couple of days, depending on how much help you feel you need, to show you how to inject the drug so that you feel safe to inject this drug at home. Sometimes it needs to be drawn up in a syringe. Sometimes that can be a little bit fiddly. And so it's just nice to be able to have the confidence to be able to do that. Another thing that's very important, and I put it in bold here, is that we can only deliver this service as part of a shared care agreement with your child's main doctor. So sometimes that main doctor will be a pediatrician, and sometimes that main doctor will be a GP. And that's because it's a relatively new drug, so we like to keep a slightly closer eye on people just to check that everything's going all right. So we will ask the shared care doctor to fill in some forms, just look out for a couple of different things, and see your child more regularly than they might otherwise do. Some people go and see their main doctor quite often, in which case it won't increase the number of appointments, but for some people, they might not go and see their doctor very often at all, in which case it might be a couple of extra clinic appointments. Okay, and then after that, you will slot into your regular clinics, either at Great Ormond Street or at Birmingham Children's Hospital. We'll see you relatively quickly, so sort of 3-4 months down the line after you've started setmelanotide, and then you'll slot into your regular clinics, and we will review you regularly from there on. But the medication will always be prescribed from either Great Ormond Street or BCH. Okay. And so what happens if you're not eligible? Because not everyone, this will not be a drug for everybody. And what I wanted to say, and I've said this before, is of course the non-drug management will always continue. Okay, so even if you start setmelanotide, it's really important to continue with the exercise and the healthy eating and all the advice you get from the lovely dietitians in the BBS clinics. Also, there are, I'm sure you've seen in the media, there are lots of other new drugs coming out for management of weight for the general population. And I think there is a very good chance that those drugs will also be effective for people who have BBS. Most of those drugs are not available to children at this point. Most of them are available to adults. And I know that there are some people out there who have already started them and have had good effect. So what I'd like to say to you is that even if setmelanotide is not for you, there are other options out there, primarily for adults. And I think it's just brilliant that we now have more and more options coming on the market. So more and more drugs that are available to help with this particular aspect of Bardet-Biedl syndrome. Okay, but I just wanted to finish by saying it doesn't take away from all the other great things that we do to try and manage weight. It is a supplement to that. But we really have to continue with our weight management through diet and through exercise. Those are really important because they also contribute to your overall health. Okay. And the last thing I wanted to say is for the people who come to GOSH, we are doing a webinar on the 15th of May where we're going to talk a little bit about this. I'm going to answer any questions you might have specifically about setmelanotide. People at Birmingham, I know you've already had a webinar. You are very welcome to come to this one as well. That's absolutely fine. But I will be saying very similar things to what Melanie has already said in Birmingham. But you're very welcome to join. But I particularly encourage people who come to the GOSH clinic, because we haven't done this webinar yet, to come along if you're interested and I can answer any of your questions about setmelanotide. Good. Okay. So the next thing I'm going to talk about is the registry. I'll just talk about this very briefly because I've discussed it before. But for those people who are new, for people who come to the Bardet-Biedl syndrome, we have a national registry. And what we do is we collect the information that we collect in the clinics anyway. And the purpose of collecting this information is threefold, really. So one of the things is to try and understand BBS better. So we've run the clinics for 15 years now, and we have learnt a lot about BBS in those 15 years. But there are still quite a lot of things that we would really like to learn. And having a registry makes it a lot easier to spot patterns and identify things that are common to people with BBS, because we are all different, but there are some things that occur more commonly in people with BBS and some things that are important for us to manage. It also allows us to give the best possible service, because we want to make sure that we are giving everybody the best service, and we want to make sure that at all 4 centres we are giving a very similar service where we can. And the next thing, of course, is getting ready for treatments. Well, we've already talked about we're there in some ways, but hopefully there will be other treatments coming up as well. And having a registry means that, again, we can identify areas of need, and hopefully we can help where there are new treatments in development. And so there's nothing outside of what happens in the clinics that goes into the registry. So it's your identifiers, your blood pressure and pulse, that kind of thing. We look at who fulfills which of the diagnostic criteria. We add the genetics, and then we add information from your eye profile, your kidney profile, your hormone profile, development for children, and then also we add your medication. And it goes for all 4 centres, so Great Ormond Street, Birmingham Children's Hospital, Guy's, and QEH as well. So we are continuing to build the database. You can ask us any questions. You can come up to me and ask me a question today. You can ask me in our Q&A session. You can ask me afterwards at lunch, whatever. So do feel free to ask any questions, and also let us know if you don't want to take part. We can always take you out. That's absolutely fine. And as I said, we think this will be incredibly useful and continue to be incredibly useful going forward in terms of spotting patterns and helping us with new treatments. Okay, so the last thing I'm going to talk about today is a bit of a new thing. I wanted to talk about sleep, and I'm going to be relatively brief talking about sleep. But it's something that we haven't explored very much in BBS, and we'd like to think about it a little bit more. We are particularly today thinking about sleep in children, but this is relevant to adults. The information I'm giving you today is also relevant to adults. And I'm particularly thinking about a condition called obstructive sleep apnea. I think we've talked about it a little bit some years back, and we often talk about it in clinic, but we haven't really covered it fully before. And so what obstructive sleep apnea is, it's basically what happens when your breathing stops and starts during sleep. Okay, so, and we know that actually in in children who have obesity, up to 60% of people have obstructive sleep apnea, which is a lot of people. And there are some risk factors, and I've mentioned a couple of risk factors here. So weight, having a high weight is a risk factor. Having big tonsils and having a relatively small chin these can all be risk factors. And we know that these are some features that many people with Bardet-Biedl syndrome have. So we're particularly mindful of this. And it can lead to lots of different health issues. So some people who are stopping breathing at night and sort of starting again, that interruption, unsurprisingly, can lead to people feeling quite sleepy in the day, because it means that your sleep is interrupted. You're not getting that really good quality sleep. You're waking up because you stopped breathing, and so the quality of sleep is not as good. Over time, it can put pressure on your blood pressure and your heart. And also, not surprisingly, if you're not sleeping very well, it's very hard to concentrate during the day, so it can lead to issues with learning and development, and that's not good. We want to make sure that we can optimize people's learning and development and ensure that people are sleeping well at night. So what are some of the common symptoms? These are some of the common symptoms. Loud snoring. Does anybody here snore? Yeah. I shared my room last night with my son and daughter, and when I woke up this morning, my daughter told me she had recorded my snoring last night. And she didn't even know I was going to do this talk today. Did you say, is she going to put it on YouTube? I hope not. I hope not. Did you have a chat with her earlier? Never mind. Okay. So gasping or snorting sounds during sleep, pauses in breathing, restless sleep, and excessive daytime sleepiness. Someone's going yep, yep, yep. So for people who are going yep, 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 it's important to go and see your doctor, because this is something that can be managed, and it's important for you and your quality of life, because actually if you've got obstructive sleep apnea, it really does affect your quality of life. If you're feeling sleepy and you can't focus during the day, that's quite tough, and it's also not good for your health. So it's very important to go and see your doctor if you recognize those symptoms. So, you know we love a questionnaire, right? At the BBS conference, and today we are asking those of you who would like to take part, who have a child with BBS, whether you would be willing to fill in a questionnaire for us about your child's sleep. And the idea is we would love to understand more about sleep in children who have BBS. Okay. And the questions we're going to ask are the age of your child, if you know the genetics, their weight and height if you know it, and then some questions about the sleep. It's about 1 page, this questionnaire, and if you have time, we'd be really grateful. And I'm going to introduce you now to my lovely colleague Theodora. Would you mind standing up, Theodora, and just doing a wave? Yeah, so this is the lovely Theodora. So when we go out for lunch, Theodora is going to be standing at that door, and anybody who would like to take part, we're incredibly grateful, and she will have questionnaires, and if you have time to fill them out during lunchtime, that would be brilliant. We're also going to have some envelopes and a box in reception to drop off the questionnaires afterwards, and we'll just finalise those arrangements just before we go for lunch. But Theodora is going to be there, and as I said, I know it's a very brief talk today about sleep apnea, but if you were one of the people going, yep, 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 with all the symptoms, that is important to go and speak to your main doctor about, because it may be that you could benefit from a sleep study, and it is a relatively easy condition to manage. And that's it. We're on to our question and answer session.